Everyone knows how important collaboration and communication is probably in any role, but I think where people tend to focus is the communication that nurses have with their patients and their families, and for example the collaboration and communication within an MDT. You get a lot of focus on those particular interactions. So I'm championing another angle, which is nurses communicating with each other and collaborating with each other, and not just within one team, but across boundaries. So I've worked and am working with a number of the big London teaching hospitals, helping to facilitate their CNS development programs, where the lead cancer nurses have said, actually, I want to get my 50, 55, 60 nurses together several times a year to work together on service improvement and learn from each other. And it isn't so much about education, training in the sense of someone at the front of the room presenting to you. It's about talking to each other and learning from each other. And I've seen it work so well when you can tap into the expertise of your colleagues, but you have to be brought into the same room together to be able to do that with enough time to actually discuss and learn from each other. I think the first challenge is just the idea to make it happen and create the facility for that. So Macmillan Cancer Support I've worked with for a long period of time, and actually they've tended to sponsor and fund many of these collaborative efforts in the trusts that I work with, because you have to actually invest in it. You've got to get people in a room, you actually have to create the space and the time. And that does sometimes mean having a day away from your patients, but there's value in that because you go back to your patients with new ideas, new ways of doing things that mean that you're an even better nurse than you were. And I think it's just that realization that it's worth that investment. I sometimes run events on Saturdays because of the difficulty of actually nurses taking time away from patients. But if you think about it, investing in yourself and what you know how to do has huge value for your patients as well. So I'm a big advocate of protecting some time every year, several days, not just several hours, to learn not just from professors or people who are educating you as such, but from each other. We've had fantastic feedback. I worked with University College Hospital in London as one of the first trusts that did this with Macmillan sponsorship, and we did an evaluation after the first year of the CNSs working that way, and they were tremendously positive about it. And I think what was really nice to see in the feedback when we did the evaluation was not just that they learned a lot and were pleased to know each other and work together, but it was this sense they gave in the feedback that they felt valued, that the trust was investing in them, that Macmillan was investing in them, and they were hugely positive about what that said about the value of their roles.